Snowboarder Shaun White made history by winning his third gold medal in the men's halfpipe. He did so with a rare heart condition called tetralogy of Fallot. The Olympian is now inspiring those suffering from that same congenital heart defect. For more on this, we're joined by Stanford cardiac doctor Seth Hollander. Seth, thanks for joining us. First off, just tell us a little bit about this specific condition.
Sure. So tetralogy of Fallot is one of the more common complex congenital heart defects. It affects 4 or 5 out of every 10,000 people and is a series of defects, but the primary disturbance is the main valve, which connects the right side of the heart to the lungs, which is called the pulmonary valve, is too small. And that makes it hard for blood to get from the heart to the lungs. Tetralogy of Fallot also involves a hole between the left and right ventricles, which are the 2 main pumping chambers of the heart, that causes blood to essentially go in the wrong direction away from the lungs in most cases.
And this is something that children are born with, correct? Does treatment continue throughout the rest of their life?
So this is a congenital heart defect. So this means that children are born with it, and we often can detect it even before the baby is born. Children who have this defect can have a wide range of severities, but nearly all patients require surgery in infancy. Things have really evolved over time. When Shaun White had his surgery, my understanding is he had it in a 2-stage or 2-surgery procedure, but nowadays we tend to do it in 1 surgery, typically around 3 to 4 months of life, if we can wait that long. And the survival is excellent, well over in the 90% into adulthood, with excellent functional quality and quality of life in most cases.
And it's interesting to see how things have changed over the years. As you mentioned, he had a different kind of surgery back then, but his appearance in the Olympics, it coincides this week with Congenital Heart Disease Awareness Week. So what do you think, or what kind of impact do you think that has on kids in the hospital who are watching him?
Well, I think it's astounding because congenital heart disease is relatively common, and there are many treatments for it. And with the right treatment, many patients can go on to live ordinary, or in Shaun White's case, extraordinary lives. Believe it or not, somebody like Shaun, if the surgery goes well, wouldn't necessarily need medications into adulthood. And if they fall under the care of a cardiologist and get approved by their cardiologist, can go on to compete not only in hobby athletics, but in his case, highly competitive athletics, as long as he has approval from his cardiologist, which I'm sure he does.
Have you heard anything from children in the hospital who see him and just aspire to be like him?
Well, lots of people are talking about him, both patients and the doctors and nurses around here. So, yeah, there's a lot of talk, and we're really delighted that we can see a congenital heart disease survivor not only surviving, but really thriving and performing to the best of his abilities. It's very nice to see. It's very gratifying.
Okay, and quickly, can you just tell us where treatment for this heart disease will go into the future?
So we always are trying to minimize the amount of surgeries patients can have, and always trying to move more in the direction away from surgery into what we call non-invasive procedures. And although it's not available now for tetralogy, we do hope one day to be able to repair either part or all of this defect without actually having to open the chest, but by rather filtering small instruments called catheters either through the neck or the groin, such that you could recover from surgery very quickly. We do this with valve replacements already in adults and children, and the technology is getting better every day.
That sounds amazing to hear. Seth Hollander, we appreciate your time. Thank you for joining us today from Stanford.